Hi, this is ZengoMD. A few years ago, I began writing a book about the health, aesthetics, and wellness industry from the perspective of an insider. That's me. The goal of the book was to help empower you to do some things, change your life, change your habits, to look and feel better in 10 years than you do today. Well, what we're going to do on this channel is explore topics as global as government, health insurance, the drug industry. But we're mainly also going to focus on topics in aesthetic and wellness medicine. And we're going to especially call out charlatanism and crooks offering procedures and promises that just aren't backed up in the literature. Our goal is to make you a better healthcare consumer and give you value for the amount of money that you spend on your own health and wellness. So I hope you subscribe and take the journey with me as we move forward on this channel. Thanks for watching.
Okay, if that wasn't enough, here's some more. After college in Virginia, I went to Emory Medical School in Atlanta, and I spent a summer at the Centers for Disease Control as a commissioned officer, but eventually chose clinical medicine with my base at Grady Hospital, the famous downtown Atlanta Indigent Care Hospital, where I was honored as Resident Teacher of the Year by the students and chosen to be Chief Resident of the OBGYN program, the second largest program in the world at that time. I went on to join the faculty, both working at a private practice based out of Northside Hospital, the largest OB hospital in the country, while still teaching students and residents at Grady and through Emory Clinic. My practice focused on minimally invasive surgery and gynecologic endocrinology. I performed the first ever outpatient laparoscopic hysterectomy at Grady and the first ever balloon endometrial ablation at Northside. My next challenge led me to a rural hospital that had only a few dozen beds, where I was the first board-certified OBGYN to serve the community in over a decade. I delivered enough babies to fill 2 high schools and often had to turn on the lights in the OR when calling a C-section at night. As my practice matured, I relocated to the home of University of Georgia. Go Dogs. But I began to question the medical establishment along with my patients because traditional treatments were unimpressive or didn't work, like antidepressants, adult ADD meds, addictive anti-anxiety medications, sleeping pills, the overuse of antibiotics and stimulant diet pills that just don't work, the overuse of expensive radiology testing, and risky traditional treatments for menopause made from, of all things, horse piss, men getting addicted to testosterone injections, and why levothyroxine did not make all hypothyroid patients feel better, why birth control pills were given to women with tubules or in menopause, and oh, those fad, high-fat diets. Ugh. And then, with the emergence of the internet, I had to prove not just to my patients, but also my colleagues, that evidence-based medicine had nothing to do with what ranked on page 1 of Google. I reshaped my practice to address these threats to our wellness, while answering my patients' requests to perform skillful, non-invasive aesthetic treatments that work at a fair price. Over the years, our menu of services has had quite a variety, and I still don't do everything on these lists today. Moreover, I've taken a firm stance against expensive, machine-based aesthetic procedures that offer little value to anyone but the equipment salespeople. Then I founded PracticalCME Medical Training to teach other providers what I have learned. Moreover, since my days of pioneering this style of medicine in my area, I've seen some disturbing trends of underqualified people competing for your business, and it's time to call it out. It started with the concept of the med spa, owned often by a non-medical investor who filled it with machines and low-quality providers. Then we began to see these skilled treatments involving prescription drugs being performed more by nurses and even naturopaths. Trust me, I have trained hundreds of people, and while there are some exceptions, there is a direct correlation between the level of the medical degree and experience with the intelligence level when learning something like Botox and dermal fillers. The recession of 2008 then led to a surge in these minimally qualified clinics offering wellness services, oftentimes using prescription hormones. A number of chiropractors who don't learn any pharmacology in school are now somehow uniquely qualified to assess complex medical and hormone issues in patients who are on other prescription medications. Here is how one chiropractor touted his own way to improve medical care, despite being only a few years out of school. You know, it takes some nerve to criticize the medical establishment when you've never been part of it, never taken one night of call, never stared death in the face or operated in a pool of blood. The only person who has the credibility to criticize the establishment is one who is trained in it and has been a part of it and escaped. And that's what this channel will do. This channel will resist disease-centered medicine. But this doctor-centered statement is incorrect, and unless you're someone who's been in the establishment, you don't understand. It is establishment-centered, which brings in drug and insurance companies. And this channel will empower you to take charge of what is really behind your symptoms to make your best choices. The knowledge of the human body possessed by an MD is not proprietary, and I will share it with you on this channel. What's funny is that some chiropractors charge more than I do for a new patient wellness visit and sell overpriced supplements that don't work. They're actually sucked into the same establishment type infrastructure that caters to chiropractors instead of MDs. So they're really criticizing themselves. Their claims of value are flat out wrong. And sure, nobody is more capable of holistic, compassionate, knowledgeable, groundbreaking, cutting-edge care than an MD with decades of training and experience. Don't fall for marketing fluff like this. Well, stay tuned here, and we'll help you spot the charlatans and become a better healthcare consumer. We are so glad to have you aboard for the ride.
So how many subscribers do we need before we get like hair and makeup? Because this ain't gonna work for much longer.